Hi, this is Steve Platek for Evolution, This View of Life, the magazine that approaches anything and everything from an evolutionary perspective. Back again with the sex, evolution, and behavior segment. I have Professor Gordon Gallup from the State University of New York at Albany, and I have Dr. Nick Armenti from UMDNJ. Nick is a clinical psychologist joining Gordon and I for today's conversation about the psychoactive effects of semen. Hi, Nick. How you doing?
Just fine, Steve. Thank you. And hi, Gordon.
Hi, it's good to be here.
All right, so last time we stopped talking, Gordon, we kind of left some things open with respect to the psychoactive effects of semen, and I was wondering if you could bring us up to speed a little bit. And some of the things that I wanted to talk about in terms of semen is what are the data anecdotally, if you will, case reports about the effects of semen?
That's a good place to start, Steve. The original article that appeared in 2002 on semen as an antidepressant generated a lot of interest, obviously, and the interest continues. I get unsolicited email testimonials from people on a near regular basis. It generated a lot of fan mail, and it generated a lot of hate mail. The hate mail came largely from lesbians who felt that any suggestion that mental health might require exposure to semen was degrading. But the fan mail comes from females who have experienced very positive effects of semen exposure, along with females that have been in committed relationships with males extending over a long period of time, and their partners have undergone vasectomies. And they've noticed rather dramatic differences in the effects, so that prior to the vasectomy, everything was hunky-dory, but following the vasectomy, their mood and depressive symptoms have returned as an ostensible byproduct of changes that were due to the vasectomy. But let me just read you some excerpts from some of the semen testimonials from women that have experienced positive effects.
Please do, please do.
I can't divulge the identity of these people, obviously, but I'll read you an edited version of one of the emails that I received not too long ago. I find your research on semen very interesting and life-changing. I was driven to study the field of psychology after my own battle with depression. I went to doctor after doctor for nearly 15 years before I came across your research linking semen and depression. My husband and I used condoms for 20 years and just recently stopped. We've been experimenting, and I've noticed that when we have unprotected sex 5 to 6 days before my period, that I have absolutely no PMS symptoms. During fertile days, we use condoms, but my husband saves his semen for me, and I rub it on my body. The more sex we have the week before my period, the better I feel. I no longer take an antidepressant. Bad news for the drug companies, but great news for my wallet. Plus, my husband loves it. I'll bet he does. I feel like I lost almost 20 years of my life because I suffered from horrific PMS. I no longer suffer from depression or PMS. And then she goes on to describe some other things. So, I mean, some females obviously experience very dramatic, very significant effects. But I don't think all females do. I think the magnitude of the effect varies from one female to the next. And I think that variation, as I think we suggested indirectly last time, Steve, is a consequence of whether there's a good chemical match between the donor's semen and the female's basic reproductive biology. I mean, I think that every man's semen is unique, and so every man has a semen signature, and whether it's a good match or not is in no small part determined by semen sampling and the effect. I mean, as I indicated previously, women could, as a result of sampling semen from different males, either wake up the next morning with feelings of regret about what they did the night before, or they could wake up the next morning head over heels in love. So I think whether or not there's a good match, both biochemical and in particular genetic match,
absolutely,
can impact the subsequent psychoactive effects of semen.
Absolutely. And Nick, before I ask you to comment on that, it's interesting to think about the chemical composition of semen being fairly, if not almost exactly, similar to the chemical composition of saliva, with the exception of a few chemicals that are unique to semen and a few chemicals that are unique to saliva. And it turns out that those chemicals, that genetic signature, might also... So while girls may not be having to bed hop at the semen buffet, as we refer to it, they might be able to kiss guys as a sort of appetizer towards what they might then sample in the seminal fluid. Would you agree with that, Gordon?
Absolutely. In fact, as I think I mentioned last time, we've done a lot of research on kissing.
Right.
And one of the most interesting findings to emerge from that work is that the majority of undergraduate males and females report on one or more occasions having found themselves attracted to someone only to discover after they kissed them for the first time that they were no longer interested.
Right, sure.
And given the possibility for the exchange of all kinds of information during an initial kiss, the exchange of saliva, as you suggest, might provide cues as to whether or not this is a good genetic match. And if it isn't, then that, in effect, terminates the relationship. There are probably hardwired mechanisms that process this information in ways that render it a make or break encounter.
Yeah, I couldn't agree more. And when I mentioned that to my class, that sometimes you find yourself attracted to somebody to kiss them, only to find that not so much, and then find someone you're not attracted to, you kiss them, and all of a sudden the fireworks go off. But
exactly.
That's neither here nor there. Nick, I wonder if you could comment a little bit as a clinical psychologist on both the excerpt that Gordon read and generally the psychoactive effects of semen on depression.
Well, okay. I'm fascinated by what Gordon had to say, because it's a real clinical vignette,
right,
to me at least, because he's describing a real. I'm impressed by the immediacy, it appears, of the effect. First of all, I would really like to see some empirically validated, data, to back that up. That's the anecdotal material is important to me, but you're talking psychoactive here. It's pretty powerful commentary for me. This is really evolutionarily informed, information that I certainly would share with a couple, for example, in terms of, forget about a wife or a girlfriend or whatever the other partner may be being depressed. The issue is sounds like it maintains mental health. So a good sexual relationship, which, it's so interesting, because one of the first things to go is what happens in the bedroom in a couple's relationship if there's going to be conflict. And, it's kind of the last thing to come back. But when it does, it's really a very rewarding kind of an issue.
Right.
So, the psychoactive qualities that Gordon describes are just mind-blowing to me. It's just incredible that and you have other anecdotes, apparently, Gordon, as well, which could form a basis for some hypothesizing and predictions based on what you observe. But yeah, clinically, I'm fascinated by it. And, from a pharmacological point of view, I think we discussed this a little bit in our emails going back and forth, that, I can't imagine she says poor drug company. But I have a funny feeling if somebody heard Gordon and you talk about this, they may just jump on this if they haven't already. I don't know. Has there been any work from a pharmacological point of view, on this in terms of, pharmaceutically? Any drug companies ever, have any, investigation of semen-based chemistry that
There's a lot. There's a lot
might
of
be?
there's a lot of steps that have to be taken, I think, before we get to that, right? Because we already know that we can deliver estrogen and progesterone and certain chemicals intravaginally and measure them in the bloodstream within minutes after the fact. The question is that if you look at, and perhaps as part of this podcast, we'll post a list so that the listeners can see the number of chemicals that are in semen. Gordon, correct me if I'm wrong, but it's something on the order of 30 to 50 different chemicals. And almost every prostaglandin is represented: estrogen, progesterone, serotonin, dopamine. The idea is that it may not be one single isolated chemical that has an effect, but a particular cocktail. In the same way that pharmaceuticals work from the bottle, and that, for example, ibuprofen might kill my pain because of my particular genetic makeup, whereas it might not be so good for somebody else, where Tylenol might be effective for somebody else. It turns out that this genetic compatibility effect is what drives it. I worry in the clinical situation, and Gordon, I wonder if you can comment on this. If you have a couple that comes in, and let's say we have a young couple, and they're using condoms because they're smart and they're not trying to have an early pregnancy. They decide to get married. They decide, okay, it's time to start trying for kids, and all of a sudden the effects of semen are not what we think they are. And so if you have a couple who's having problems, and you encourage them to say, well, perhaps there's something in semen and semen chemistry and genetic compatibility, and it turns out not to be the case. The point we don't want our readers or listeners to take home is that semen doesn't necessarily make you happy, right, Gordon?
That's absolutely correct. A lot of people have misconstrued our findings on the antidepressant properties of semen by saying that semen makes you happy. Well, just because you're not depressed doesn't mean you're happy.
Right.
True.
That's
true.
for sure.
True.
It's unlikely that you could be depressed and happy, but
right.
If you're not depressed, that certainly doesn't mean you're happy. And if you're not happy, that certainly doesn't mean you're depressed. So it's very important to distinguish between the absence of depression and the presence or absence of happiness, that's for sure. But it's interesting to speculate about the prospect of creating simulated semen suppositories that might be at some point used by females to modulate mood and counteract depressive states. But I think you're right, Steve, that that's probably in the very distant future. The first step is to find out what the chemical components that are responsible for this effect might be, and then determine why there may be such dramatic individual differences in how females react to semen exposure from different males, and that's going to be very difficult to factor into the production of synthetic semen as an alternative to the use of more traditional kinds of antidepressants.
Yeah, I agree. Gordon, Nick, you wanted to point something out?
Yeah, a couple of things. One was, I know you're referring, I believe, to the MHC, issues, perhaps that. And also you referred, Gordon, to suppositories. So interesting. Not necessarily an oral application, but what we do know is that the absorption of chemicals in the vaginal area is so quick. It's incredible. We know even drug abusers who were cocaine users who, they would in fact insert it in the vaginal area, and it would be an enormous quick absorption. So that pathway apparently has evolved to do just that, and evolved as a quick pathway for absorption. It's just amazing to me. So yeah.
Yeah, that maps on very well to our previous discussion about uh, route of administration.
Yeah.
Right.
And as you know, I mean, drugs that they depending on how they're administered, their effects can change dramatically. So it'd be one thing to create a synthetic semen, but then the question of route of administration would be a very important consideration. And obviously, in terms of our evolutionary history, the preferred route of administration, it seems to me, would be vaginal.
Mm-hmm.
And the vagina is an ideal, as you indicated, drug delivery system. That's for sure.
Mm-hmm.
Steve, your comments about
it's a veritable sponge.
Yeah.
well, it is for certain things.
That's right. That's right. That's right.
Your comment about a couple that is using condoms and then gets married and throws their condoms away so they can now have kids and discover that the romance and bliss is lost would be a great example of what's called evolutionary medicine.
Mm-hmm.
Because condoms were not part of human evolutionary history.
True. That's
by modifying our existence through current technology, in many instances, evolutionary checks and balances can be upset. And this would be a classic case in point.
Yeah, absolutely. I mean, this is tantamount, to Bowlby's biological mismatch hypothesis, right? The idea that modern technology is what's making us sick because we're carrying around an archaic Stone Age brain or Stone Age phenotypes. Nick, we should mention that Nick is one of the founding fathers of the Applied Evolutionary Psychological Society, a pre-conference which will be held this spring in Plymouth. And when we talk about evolutionary medicine, Nick, as a clinical psychologist, how could this information about semen or even about reproductive compatibility, I mean, is this the kind of stuff that can be, forget about Match.com, forget about eHarmony. Is it now going to be, evolutionarycompatibility.com, that where you find your perfect mate, where you make great babies? I mean, what is your thinking on that?
Steve Playtech. Yeah, we're gonna launch that website with all kind of goodies that you can. I would imagine. I mean, if you drill down and really use this information that Gordon has laid out so beautifully, and some of the data that backs up, it's beyond theory. I mean, I would like to see replication. There's no question about it. So hopefully this will be replicated, and we'll have plenty of data to support a predictive hypothesis on this. And with that, I mean, there could very well be the whole issue of getting a good match. Now, whether it's going to go to eHarmony.com or Helen Fisher's going to get a hold of it and really do a job on it is another question, But I mean, it does have that practical, quality about it, and talk about an applied aspect of evolutionary science. This certainly would be one of them.
Yeah, excellent.
I'm kind of preoccupied, as you know, when I hear a finding like this. That's why I emailed you right away when I saw the podcast. Was I try to think in terms of how can I use it as a clinician, and what's the applied aspect of this. So yeah.
It's good that people are thinking like that, actually. And Nick, you had mentioned in an email to Gordon and I that you did some work with gay males, and
right.
Gordon and I were talking a little bit last time about route of administration, and that in gay men, they will sometimes smear their partner's semen on their body, or ingest it, or take it anally. And I wonder if you have any thoughts or commentaries on that finding.
Let me just interject something at this point.
Sure.
That we've encountered several gay males who indicate that following unprotected anal sex, the one that has been inseminated will attempt to retain the semen for an extended period of time. That is, they'll lie on their back and hold their feet in the air, or they'll even use butt plugs in order to prevent semen loss, which strongly suggests that they're experiencing reinforcing psychoactive effects of this semen exposure.
Mm-hmm. Mm-hmm.
That to me is fascinating. Now, I got to be honest. In all my work in the years I did with the gay community, which was really fascinating and so interesting, I didn't know about an anal plug, for example.
Okay.
But what I was clearly exposed to by the gay community, males primarily, was the enormous pleasure and delight that they would report in terms of their sexual activity, without a doubt. Now, we might categorize it as promiscuous, that's for sure, at one label, but certainly it would support the idea that there were certainly psychoactive effects, and it was a rewarding experience. I think more than just, I think that the rewarding aspects, as you're beginning to point out here, have a much more and probably non-obvious impact that is a much kind of deeper rewarding system. So clearly, the experience I had in the gay community there was one that would support what you're laying out here. Yeah.
Now, does that hold true for lesbians too? Offline, Gordon and Nick and I have been emailing a little bit, and what is the take on these effects? So, I mean, I have to be honest. When I tell my classes these results, which I do in almost every class I have, the men are pleased by it. The women are less pleased and a little bit suspect of it. And any students, and I haven't had many, who are lesbian, homosexual females, are not only suspect of it, but a little bit put off by it. And I wonder if either of you could comment on that.
Well, the thing that makes lesbians unique is that they're having semen-free sex.
Right.
Yeah.
And the counterpart to that among heterosexual females are those that are using condoms. Using condoms means that you're having semen-free sex. Mm-hmm. And it's not a question of whether or not you're having sex. We found that the scores on the Beck Depression Inventory don't distinguish sexually active heterosexual females who are using condoms from females that are not having sex. Mm-hmm. So It's not a question of whether you're having sex, it's a question of whether you're being exposed to semen that seems to account for most of the variance in scores on the Beck Depression Inventory. But here's an interesting testable hypothesis, and one I think you'll find interesting, Nick, because it does have clinical implications at the same time. I would predict that among sexually active heterosexual females that are engaging in unprotected sex and therefore are being exposed to semen, mm-hmm. the likely effects of semen would depend on whether or not they're using petroleum-based vaginal lubricants. I would predict that petroleum-based vaginal lubricants might block the absorption of semen through vaginal epithelial tissue and blunt the psychoactive effects. So it'd be very interesting to compare females that are being inseminated on a regular basis as a function of whether they're using, number one, vaginal lubricants, and then number two, partitioning vaginal lubricants into those that are petroleum-based versus other alternatives.
Yeah, water-based type.
Yeah, that's right.
Exactly.
That's right. That's a very interesting hypothesis there. That's testable. Very
easily testable.
Easily testable. Easily. Let me change gears a little bit, right? Because we're talking about some of the clinical aspects and this sort of thing, but let me change gears and let me get you guys to talk a little bit about these effects when they're mentioned in the animal world, when they're mentioned in non-human literature. They're discussed in terms of male manipulation of female state, behavior, or fertility, almost like a pheromone. What is the take-home message with respect to humans and I'm not suggesting humans are special in any way, as you both know. I don't feel that way, but is this in a sense a male manipulation of female behavior? That is, in lieu of a reproductive compatible match, exposure to my semen or your semen or whomever's semen is, in a sense, if that modulates her mood, that increases the likelihood of further reproductive success, therefore siring my offspring or whomever's. So is that what's happening here? Like I think sometimes when we put this out there, people sort of miss the forest for the trees, and they see semen as an antidepressant. Oh, that can't be true, right? Mm-hmm. But when we break it down to a comparative analysis, and we say, well, perhaps this is an evolutionary functional design for males to be able to manipulate the reproductive biology of females. Now it becomes an inherently more empirically based testable hypothesis that people are, pardon the pun, better able to swallow. So, I wonder if you guys could comment on that.
I think you're absolutely right on the money. When you look at semen, the psychoactive properties of semen, as well as semen chemistry in general, you're really looking at evolution in the context in which evolution occurs, and that's at a molecular biochemical level. Mm-hmm. And it's these molecular biochemical changes that eventuate ultimately in behavioral and cognitive changes. And the fact that males and females have dramatically different reproductive best interests is not only played out at the level of dating and experience, but it's being played out at the level of semen chemistry and vaginal chemistry as well. Yeah. There's good evidence that when a female is exposed to unfamiliar semen, that she shows a spermicidal immune reaction, and her body treats the semen as a foreign protein in much the same way that it would pathogens. Mm-hmm. And contained in human semen are all kinds of immunosuppressants that reduce this effect. So being played out at the level of vaginal and semen chemistry is this continuing competition that would promote the reproductive best interests of males at the expense of females, and vice versa. There's been a lot of very interesting recent work that's come out of the artificial insemination literature, where they look at the potency of seminal samples from semen donors as a function of the context in which it occurs. And they've discovered that the likelihood of impregnation as a result of artificial insemination depends on how the semen is collected, suggesting the possibility that men unwittingly may adjust the chemical composition of the ejaculate to fit the occasion. And let me give you some examples. It's been determined that semen collected from males who produce semen samples through masturbation and use their imagination to achieve sufficient arousal aren't nearly as potent as seminal samples collected from males who are allowed to view, for example, heterosexual pornography. There are also differences in the potency of semen that is obtained as a function of whether or not it involves vaginal intercourse. So you can use coitus interruptus to collect the semen, or you can wear a condom, which enables the male to ejaculate during sexual intercourse. And ejaculates that are collected as a result of sexual intercourse are much more potent than ejaculates that are produced by masturbation, or even ejaculates that are produced by coitus interruptus. So it would appear to be the case that there are mechanisms operating at a testicular level that adjust unknown features of the ejaculate to make it fit the occasion. And there's also good evidence, Steve, you're aware of this, that if you have males provide seminal samples while they're viewing heterosexual pornography, if you manipulate the number of penises in a heterosexual video, as the number of penises goes up, the sperm count goes up. And in the ancestral environment, a sexual encounter that involved multiple penises raises the prospect of insemination by multiple males. So it activates sperm competition mechanisms operating at the level of the testicles.
So Nick is indicating. Nick, what would you like to say?
I have two issues. One has to do with some, I think, previous previous paper that Gordon published. Maybe you were involved. I don't know, but one has to do with the issue of bad boys. And what we know is women who are either married or in committed relationships often are attracted to bad boys. And at least some of the data I'm aware of and some of the information would indicate that women would prefer at times to be impregnated by their bad boy boyfriends than their committed partners. And in fact, that happens. In fact, I could pull a book off the shelf here that shows I think 10% of paternities turn out to be not, or I think it's higher than that, not the fathers that they thought were the fathers. Okay. So that's one issue. The other one is, Gordon, I believe you published a paper about, the evolutionary adaptation of the shape of the penis. And that is that it is designed to extract, perhaps the semen of a previous partner. Now, I want to get this correct because you guys.
You're absolutely correct.
Yeah, spot on.
Morphology.
See, I see that dynamic as kind of built into exactly what it is you're talking about manipulation of the female or whatever. I mean, that seems to dovetail with what we're suggesting here. So.
Absolutely. I couldn't agree more. Indeed, let me try to make a case that not only is the human penis an internal insemination device, it's also a semen displacement device that enables males to compete with the semen of other males left in the female reproductive tract. And in the third instance, it's a baby basting device. Semen contains a lot of pregnancy and placental hormones, so that women that are routinely inseminated by the baby's father during pregnancy have a lower risk of things like preeclampsia.
And it's another indication of manipulation of the female.
Yes, it is.
Exactly. And here's another very interesting testable hypothesis. That contained in semen are all kinds of sex hormones, which should come as no surprise. But what is kind of surprising is that it contains a lot of female sex hormones as well, including follicle-stimulating hormone and luteinizing hormone, which are the critical hormones that regulate the ovulatory phase of the female menstrual cycle. And we think the reason that these hormones exist in human semen is a consequence of the fact that human females no longer produce easily detectable salient ovulatory cues. They become concealed ovulators. So males, in effect, have been selected by their evolutionary history to manufacture semen that contains the essential triggers for ovulation and may induce ovulation as a consequence of semen exposure. And this is one way to account for the fact that instances of rape and forced copulation produce a higher likelihood of conception than instances of consensual encounters. And I would predict that if you took semen samples from rape victims, which is part of the rape kit that's routinely used if women go to hospitals following an instance of being raped, that if you analyze those semen samples for the levels of luteinizing hormone and follicle-stimulating hormone in comparison with consensual samples, that there would be an enormous difference.
Well, I mean, to add to that, I have 2 points to add. One is, earlier we were talking about collection of semen for artificial insemination, and I would never recommend using a rape kit for artificial insemination, but what you could do is subject semen, sperm in particular, but semen as well, to sperm motility test and pit it literally against sperm that were collected from consensual sex using a condom. And you would predict that the sperm, given those data, you would predict that the sperm generated from a forced copulation ought to be some sort of better motility. They have something is going on in the event that they are resulting in higher incidence of pregnancy. But let me back up. The idea that semen has luteinizing hormone and follicle stimulating hormone, and people are going to hear what you say, Gordon, and they're going to say he is a crazy, insane professor. But you're not, because here's the thing. To assume that semen could influence the reproductive state of a female is not a huge jump. Martha McClintock at University of Chicago a couple of years ago did a very clever study. She extracted steroids from the underarms of girls at various stages of her menstrual cycle. She then placed that extraction on the upper lip of other girls that were naturally cycling. And within a period of 2 months, the girls who had the extract smeared on their lip adjusted their ovulatory cycle to the chemicals that were placed on their lip. So if you can modulate the reproductive cycle from an underarm excretion, the idea that the intravaginal secretion of semen can adjust or even enhance ovulation, it should be of no surprise to anyone. But,
well, Steve,
but hang on, hold on. Nick has a comment.
Well, just we've alluded to the somehow the manipulation of the male of the female, but at the same time, I mean, you're more aware of it than I am, but I'm aware of what happens in the intervaginal environment that is controlled also by the female. You talk about the motility of the sperm, for example. I mean, a female can, in fact, with one partner, I believe, they're very complex creatures, are women who are reproductive factories, and they control the reproductive process, as I understand it, in ways that are just unbelievable internally, biologically, physiologically, and I believe they can affect the sperm itself in various ways by somehow manipulating the intravaginal environment.
Indeed, there's evidence to suggest that whether or not the female experiences orgasm can affect the likelihood with which the semen move up through the female reproductive tract. That is, the vaginal and intrauterine contractions that accompany a female orgasm may aid and abet and promote sperm motility.
Mm-hmm.
And there's very good evidence to show that when females have extra pair copulations, when females engage in sex on the side under conditions of infidelity, they're more likely to experience orgasms. And we've collected data that show that females that engage in extra pair copulations rate their orgasms as more intense as well. And I would bet you that the intensity of the orgasm is going to impact the effect that orgasm is going to have on promoting sperm motility and the likelihood that sperm are going to make it up through the cervix and into the uterus and ultimately into the fallopian tubes so as to encounter an egg.
Yeah, I agree wholeheartedly. And I think what Nick was alluding to is in the same way that a male under conditions of, say, masturbation, copulation, coitus interruptus, produces a variable seminal ejaculate, perhaps the presence of a high or low quality male or the conditions under which that intercourse were to occur, they may manipulate more than just the gross motor behavior of a female orgasm. They might adjust other chemical processes, for example, like the immunoresistance to semen in the vagina. I mean, the vagina, the female reproductive tract, is an extremely hostile environment to sperm. And the reason is that it's a selective process. But under conditions of being copulated with a high-quality male, you would predict that females would induce their own immunosuppressants in the interest of selecting his offspring relative to lower-quality males.
Or at least put their immune system on hold.
Yeah, that's what I mean. Yeah, so something like, that's a hypothesis, it's testable. I don't know any data that exists on that, but wouldn't that be fascinating to show that females induce a set of immunosuppressants or some kind of, like you said, put your localized immune system on hold, almost like an anti-allergy pill almost, in terms of this one copulatory partner, whereas with other copulatory partners, it might be best to induce an immuno-expression so as to try and prohibit his sperm in any way whatsoever from reaching the egg.
I'll bet you my PhD, Steve, that if you were to collect semen samples...
It'll go right there.
What's that?
It'll go right back there next to Darwin's picture.
I'll bet you that if you were to collect semen samples from males and manipulate the pornography that they were watching in order to produce the sample, that if you were to vary the reproductive viability of the female depicted in a pornographic episode, that the sperm count would be proportional to the reproductive viability of the female. I'll bet you anything that there are these context-specific effects that are likely to impact the composition of the ejaculate and the ultimate consequences of a sexual encounter.
But I mean, this
that would work to the male's reproductive best interests, obviously.
Essentially, well, perhaps. However, under those conditions, the female could modulate her internal environment. I mean, what we're talking about here is what's generally in the public called the battle of the sexes, except we're literally talking about the battle of the sexes between the legs.
Well, yeah, very and deeply. I mean, this goes beyond the common notion of mate selection. I'll tell you that.
Absolutely, absolutely.
But rather than being a battle, if it's a mutually reciprocal, perfect match, rather than being a battle, the responses of one serve to aid and abet the reproductive advantage.
Let me share this. This is a little tangential, but for years I was fortunate to run a group of abused women, married and not married. And the one of the major dynamics that a woman would bring in is, I met a guy, and the other women, there were all women in the group, as many as 8 women at times in my group. And they would go, "Oh God, all right, tell us, is he a nice guy? Or what kind of guy?" If he was a nice guy, they would go, "Forget about it, it's not going to happen." So the question was, what is it about these bad boys, even before I knew the concept from an evolutionary point of view, that attracts you? And if I had to pick one phrase that jumped out, it was, they just made me feel alive. I mean, I had none of this information, was able to talk about it on the level of semen. But in terms of what they got out of these bad boys was so much of what you guys are talking about, And these are the hidden unconscious kind of things that go on. I call them that from a clinical point of view, but they are obviously operative dynamics that keep these relationships going, So it was fascinating when I look back. It was years ago. That was years ago.
Yeah.
Well, the interesting thing about, you mentioned females that are in abusive relationships. It turns out that one of the components to seminal fluid or seminal plasma is oxytocin. Mm-hmm. And oxytocin has been demonstrated to produce enhancement of social bonds. Affectional and social bonds are enhanced as a consequence of oxytocin exposure. And females experience oxytocin release when they orgasm. Mm. So if they have an extra paracopulation and a very intense orgasm, and they're inseminated by a high-quality male, they're getting a double dose of oxytocin, an endogenous dose and also a dose applied by their partner. And I would predict that among women in abusive relationships, those that stay in those relationships are probably having unprotected sex with their partners. And so the oxytocin exposure they're receiving serves to cement the relationship and minimize their chances of being able to extricate themselves from that relationship based on the basic biochemistry.
That's fascinating. That's fascinating in terms of talk about almost an addictive quality after what dopamine systems or whatever mediators are going on at the hormonal level. Wow.
And that's testable. I would predict that women using condoms would be far less affected than women that are having unprotected sex.
That's right.
Now, you and Becky Birch did some work with abusive men, right? Who
So that's for another day. That's for another day, Nick. Yeah. So we're gonna have to wrap up for today. But boy, has this been stimulating. And I hope our listeners will find it stimulating as well.
I appreciate your inviting me. Thank you.
Absolutely. Nick, we'll definitely have you on again to talk about apes. And Gordon, we'll be back in action in about a month. And so I hope everyone enjoyed the show. Do you guys have any final comments?
Well, let me just tell Nick that it was a delight to have him on the show and to interact with him. It's really nice to have somebody with a different perspective provide some input, and it was very stimulating, and I thought a very productive exchange.
Yeah, interacting with you fellows who are so knowledgeable about this is a real breath of fresh air for me. Thanks, guys. Appreciate it.
Our pleasure.
All right.
Thank you very much, guys. And until next time, this is Sex, Evolution, and Behavior.